Dumelang Baina, Mema Muruti, Dr. Bila, and the congregation at large. Thank you very much for this opportunity. It is not often that we hear of health workers being recognized and appreciated, and particularly in these challenging times during an epidemic. Generally, when we hear of health workers, it's when there is a lot of criticism being thrown around. So it is such an honor that I am being given this opportunity to speak to the congregants. Baina, I have been given a very short time and I'm going to try and make it as quick and swift. I would like to believe, Huri, you can all hear me. Thank you so much. It was a difficult time. Can I have an opportunity to share the screen? I seem to be blocked. Thank you. It's been a difficult time of COVID. And I wish to indicate that when Muruti asked me to do this, I felt deeply challenged. I felt I needed to dig deep, and in some instances, I felt, I actually don't want to go back into that space, as this was a difficult and painful time, even for myself as an individual, let alone being a nurse. I wish to indicate that as I'm speaking as a nurse, I'm not just speaking for myself, but I'm carrying the voices of many other healthcare workers who, given a chance, would have expressed some of the sentiments that I'm going to be sharing with you. And the outline of my presentation is in this format. I'm going to be giving a brief on the 2020 World Health Declaration and basically touching on the nurse's role. And then I'll go on to talk about my individual experiences during COVID. The scripture that I've put up there for you is one that I hold dear to my heart and one that I use whenever things don't make sense to me. This was a difficult time for Esther. There was a plot being made to decimate the Jews. And Malumo Haye goes to her and says, Esther, who knows, you were probably made queen for this very purpose. So when we were sitting during our planning, when we heard of the possibility of a pandemic, we started planning, and it was during this planning as a facility, Koshalot Matleke, that I asked myself, why am I here? What is it that I'm supposed to be doing in this space? Am I supposed to be here? Shouldn't I take my bag and walk away? Is there a different or bigger understanding to my purpose in healthcare? It was challenging, it was frustrating. I had dealt with a pandemic before, not a pandemic per se, but an outbreak. And the largest and most scariest was Ebola. And even then, I wasn't directly involved in the care of this patient. This was many moons ago, I think in 1996, when we lost Sister Meryl Lahana, who was looking after that Ebola patient who had been brought into South Africa. So very briefly, just to indicate to the rest of the congregants who are not in healthcare, that the World Health Organization had denoted 2020 as the year of the nurse and the midwife. This was to be in celebration of the 200th birthday of Florence Nightingale, whom everybody knows as the mother of nursing, the lady with the lamp. When we had this, and I think when the World Health Organization planned on this, it was to recognize the contribution of nurses and the risks associated with nursing, because generally people don't know the burdens that comes with being a nurse. But Runa Hemanese, we were very excited about it because we thought, for the first time since I've been a nurse, nurses are going to be celebrated throughout the year. We normally celebrate Nurses Day on the 12th of May, which is Florence Nightingale's birthday. most organizations would have an event celebrating this, and the event might span anything from a day to a week, depending on the organization and the size thereof. But because now it is declared the whole year is the year of the nurse, we were expecting to be celebrated every day. You know, we were expecting today there would be an event somewhere and we would be hearing that nurses are being celebrated. Lo and behold, we did not know that we would be sitting in the middle of a pandemic. I must say, when I first heard of the pandemic, we were driving from Butlokwa with my sister-in-law. And we tried to rationalize what was happening. And in rationalizing, we were looking at the fact that, well, 2020, when you translate it in terms of vision, you understand that it is about having a clearer vision. So we were saying, Mohlomong Modimo wants our vision to be clear about who he is in our lives and who we are in his mission. And little did we know, hore ka di 10th of March, it would be declared a global pandemic situation. And this is how my year started, Bazalwane. You will note that the slide is jumbled up. It's jumbled up for a purpose and for a reason. I started the year with that first screen grab that you can see here, where I was planning my year. This was on the 31st of December. It was at 7:45, and I was putting into plan where this is how my year is going to go. Then on the 5th of January, there was a service in my church where Muruti was teaching us, our Bishop Musa was teaching us about the clarity of goals, relating this to our 2020 vision. Remember the concept of having a clearer vision in the year. Little did we know, we will then be in a pandemic. There I am telling everybody, I'm a healthcare worker, please stay home. And I'm asking myself, why am I called here? Why am I here? What's happened to my vision? Was my vision correct? And I started, I think around April, immediately, a few days after the lockdown was announced, I started noting down my reflections every day. I have to say, Baina, it was a difficult time. I recall when the president announced lockdown, I was sitting on this very couch that I'm sitting in, and I cried. I cried silently because I did not want my children to see that I am struggling with this announcement. I realized that it wouldn't have made sense to them. I cried because I was concerned, in our country, where health literacy rates are so low, people would not take this seriously. People did not understand what it meant that we are in the middle of a pandemic. I was challenged in that now we are no longer just going to be nurses that are nursing at the bedside, that are known to be feeding or giving medication to the sick, that the role expands to much more than that. And when I'm talking about a nurse in this instance, I am talking about those people that have completed their basic education and training and who are now authorized by the regulatory body. And in South Africa, it is the South African Nursing Council. I realized that the roles that are normally written down in books and that the public knows of nurses have now changed. In fact, my own role had to suddenly change. I am supposed to be making sure that patients are getting good service. I'm supposed to be making sure that standards of care are at a level that is acceptable, but I now had to change my role and add into it being a member of the Joint Operations Committee for COVID readiness. And this is over and above the roles that you are seeing there. And Bazalwane ke beile di roles more that I know people don't normally know that nurses are participating in. Mostly people would know nurses to be those people that take care of the sick, that would be feeding the sick, that would be bathing them, that would be dressing wounds. But I'm aware that our public do not know that we lead research and we inform policy. And such an example would be when initially we were dealing with COVID, we had the isolation days were initially put in at 14 days. But after a month or two, we realized that as the Joint Operations Committee, that it actually does not make sense for it to be 14 days because science had taught us a thing or two. So we then informed the minister, we made the minister aware that the 14-day policy is not necessarily cast in stone and it's actually not true according to science, and therefore the policy was then changed to 10 days. As healthcare workers, as nurses, we develop practices. We make sure that our practices change depending on what scientific knowledge is telling us at the time. And nurses, for that matter, happen to be the core. Manese batshwana le di traffic conductor at a traffic circle when it's not working. We make sure that things connect and things work the way they're supposed to work. Nurses are the ones that at the end of the day make sure that every healthcare giver is supposed to be looking after this patient are coming together with one common goal of making sure that the patient gets better. Having said this, people are not aware that nurses are working in very dangerous circumstances. Being a trauma nurse, I had to one day experience people coming into our trauma high care to come and finish off a patient that they had shot in the streets. These are not issues that come out to the public, and the public is not aware that we live in these circumstances. Now, worse with COVID, where we were at risk of catching the disease ourselves. I was looking this morning, trying to find the latest stats on healthcare workers who were affected by COVID. And on the 7th of August, the minister had indicated that over 14,000 nurses had contracted COVID, over 1,600 doctors, as well as another 11,544 healthcare workers. These are cleaners, porters, any other person except nurses and doctors also had contracted COVID. Now, it becomes difficult for the public to understand that we had to sacrifice ourselves and put ourselves in the line of fire. This was when everybody was scared to go out, when everybody was told not to go to work, but healthcare workers, nurses, doctors, physiotherapists, cleaners in a hospital and clerks in a hospital had to go to work so that at the end of the day, the care of our patients is not compromised. I have to indicate, Baena, it was scary. It was scary because I myself was scared. But over and above being scared, there were times where I got angry because I realized that all of a sudden, everybody was an expert in healthcare. People had opinions and nobody was asking nurses and doctors their opinions. You know, you had, if you were listening to the radio, every talk show host was now an expert in healthcare. You tune on to the news, everybody, it was talk of this COVID and whatever is supposed to be happening, but none of them were listening to us. This was for me the biggest frustration. And at a time where I was realizing the sacrifices that we were having to do, I thought, sometimes people would have to step back. I had seen what had happened in European countries, and there were every now and again, especially in the UK, you would see rows of people in the street clapping hands when healthcare workers were going to work. And that was not happening in our city. And I was saying, but what was wrong? What's wrong with us? But I realized, Modimo ha re beile mo re beileng teng bana besong. O re beetse because a tseba hore re bomang re hokae. And he gives us the strength to carry on. Besides being a nurse, I had to become a marshal. because in our hospital, we see in excess of over 7,000 walk-in patients. Now, there's a new culture that has to be inculcated in our communities, and people have to maintain social distancing. We now have to implement a process of screening. Obviously, as much as the public is hearing this in the news, we have to make sure that when they come into the facility, they get the same explanation. Now, as we are engaging with the communities, you are talking something completely new. They haven't had it there. It's like the news is not filtering down to them, and one had to go into that role. I also realized that I needed to be a go-to person for my friends at work and my family at home. When my colleagues were testing positive for COVID, I had made it my responsibility to contact each and every single one of them every day to make sure that they are okay until they came back out of quarantine. I'm going to talk about grief last because I want to share this video with you, which sums up my experiences. But I also want to tell you that it wasn't all doom and gloom, because there's hope. A lot of the preachers in the churches were sharing the word with us, and that strengthened us. A brief video that I'm sharing with you.
Oh, Tshidiso, it's not showing here. Can you just check it?
Okay. It's not showing by them now. I apologize. I hear that it is not showing. I will send it to Osma Khotso and she will share it with everybody. But over and above all, the video is talking about grief. And the grief is the experience of the nurse who's looking after these patients. And she's crying because she's seeing many of them dying. And she's crying because the patients that are dying alone. Because with COVID, we couldn't comfort them, we couldn't touch them, we couldn't hold them. Families were not allowed to come into hospitals to be with their loved ones during their last days. As I wish to thank you, colleagues, I wish to also reaffirm my pledge to the service of nursing. I wish to thank my colleagues who are in the field, who have carried on and fought this battle. I wish to thank the friends that have made it easy for us when we were having difficult times. I wish to specifically thank my best friend, Dr. Bila, for being my ledge, for being my crutch when things were difficult. There were times where I couldn't see what was going to be happening the following day. I was starting to worry that I'm losing hope. And he kept on with his daily devotions, sharing the word with you. I wish to thank the ministers of the word of God, Bishop Musa, the bishops T.D. Jakes of this world, the Bishop Matebulas, because without you sharing the word with us, you are the ones that strengthened us during this difficult time. And thank you for the Christian community for seeing it fit to share and to acknowledge us on this day today. Thank you, Mema Mruti.